All the patients who come to us, we advise them about the treatment, chemotherapy or surgery or radiotherapy. Along with this, we always tell them about the physical activities. They always ask, because the relatives normally, what they do to the patient, they tell the patient, please don't do this, don't do this, don't do this, don't walk, take rest. That's a normal advice by the relatives to the patient. And patients are troubled because of that. In fact, what we do is, we tell the relatives, don't do this at all. Encourage them to walk and move as much as they can. And therefore, that's the only way to keep the patient more happy also. The commonest thing which happens is the patient feels little weak, and particularly after chemotherapy or after radiotherapy. And the recovery will be much more slow if they take more rest. That's very clear cut. And therefore, I always tell my patients that please do everything that you can do. There's nothing that I'll tell you not to do. Go for a walk, go for swimming, go for exercise, indoor cycling. You can go for the all other exercise, yoga and all, which everybody has to do it. And normally patients are very, once you tell them, they understand this and they carry out. I always advise them, walk at least 5 kilometers every day without fail. And they come and tell me, oh, they have done 2 kilometers, they have done 3 kilometers. So they are keeping a watch on that. And I think that allows them to recover fast. People who are taking rest more, they always come after 6 months. I'm feeling very weak and I put on weight. I say the reason is simple, that you are not doing exercise. So you go back and take the exercise. Lastly, there's at least some data that in breast cancer, the risk of recurrence is less if the patient is doing 5 kilometers walk every day after the treatment. So that data is there, which indicates that good amount of the exercise allows the fat consumption and therefore reduces the risk of relapse.